Hello, 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 and welcome everyone. The room is filling up. Already over 200 people here. So excited to welcome y'all in from all across the country, all across the globe. We have a special treat for you today with this panel. I am going to introduce the moderator for the panel today, Dr. Erin Espinoza. She joined Evident Change in 2019 and serves as a director of research. And prior to joining Evident Change, she served as a director of the Texas Center of the Institute for Innovation and Implementation out of the University of Maryland School of Social Work. Say that 5 times fast. All right. As the consultant, she also served as co-lead for Texas-related efforts for Mental Health and Juvenile Justice Action Network and supported the John D. and Catherine T. MacArthur Foundation. Her accolades and the list goes on and on. You're in good hands today with this panel. We're so excited to welcome you here, Dr. Erin Espinoza, and I am going to pass the mic over to you to introduce the rest of our panelists.
Oh, wow, Ashley, thank you so much. And you know what? I need to send you that $50 gift card for all the nice things you said. I really appreciate it. I cannot be more honored to get to spend my afternoon with the folks, my colleagues and new friends on this panel, and to get to hang out with all of you all across the country and in the great work that we do in children's mental health. So before we jump in, and again, I'm the least important on this panel by far, and it was weird to hear Dr. Espinosa. I kept looking for my sister because she actually got it first. But anyway, I'm going to introduce our panel, and if I can ask my panelists or our panelists when I say your name, and can you just wave your hand? And if I mess up your bio, by all means, feel free to correct me. Is that cool? Can I get a thumbs up from my teammates? We good with that? Awesome. So first we have Kristen Powell. Kristen's the co-founder of the Lost and Found Institute, and back in 2023 that was founded. The Lost and Found Institute works with youth and young adults impacted by care and trauma systems to help them navigate liberation and healing. From a former foster care kid and an incarcerated youth to a survivor of human trafficking, Kristen is a testament to the power of the human spirit. She has been working in various roles that involve survivor-informed, survivor-led services, holistic healing, journalism, and policy reform. Never mind the fact that she's also got her bachelor's degree in criminal justice sociology and has lots of public speaking experience. So if you could do, Kristen, can you say hi? And did I miss anything that you want to share?
No, you did great. Hi, everybody.
Yes. Great. Thank you so well. It's easy to do when you wrote it and sent it to me. I was like, at least we can read. I passed the first test. Next, we have Mary Viano. Mary, did I get your name right this time? I practiced. I told you I'd mess it up. I got it good. So Mary is the Associate Director of Parent Professional Advocacy League, a family-run organization based in Massachusetts. With lived experience as a parent of children who were involved in the juvenile justice system and a long background in advocacy and systems change, Mary actively engages with systems, families, and youth. Mary, can you wave at everybody? And did I miss anything you want to make sure you highlight that people know about you up front?
No, you are great. Thank you.
Well, that's so far 2 for 4. We're going to keep it going. Evelyn Clark. Evelyn Clark is a Mexican Native American woman specializing in justice, equity, diversity, and inclusion, leadership development, youth and family voice initiatives, and peer support. Evelyn has over 15 years of experience serving youth and families within the systems of care. In addition, Evelyn is a proud recipient of the 2017 Whatever It Takes Behavioral Health Award, the 2019 Peer Alternatives Youth and Young Adult Leadership Award, and the 2023 Peer Award for Equity, Diversity, and Inclusion and Social Justice. I feel like you never sleep, Evelyn. That's what that bio just told me. Did I miss anything, or are we good?
You did not, but hello, everybody.
Welcome aboard. Last and certainly not least is my colleague and friend, Dr. Cam Williams. Cam is a certified social worker and a Compton, California native, is the founder of Interventionology, LLC, and a researcher with the company I happen to hang out at Evident Change, with over a decade of experience. She also serves as co-principal investigator alongside myself for a National Institute Justice funded project where we're examining the community, contextual, individual, and sociological influences and correlates to girls, gangs, the cartel. And some of the things we're finding there, I think we can attribute to this dialogue today. So Cam, can you say hi to everybody and let me know if I forgot anything in your bio?
Hello, everyone. Great to be here. And you did great, Erin.
Oh, well, thank you. I should stop now. Panel over, since I successfully at least got through the bios. I appreciate that. All of you have been great. So I just want to spend a quick minute to kind of frame the issue. There's not going to be any death by PowerPoint. This is totally a conversation, a virtual tea or coffee, whatever your drink of choice is. And I'm going to ask my panelists once we get going to please be off mic and contribute like if we were really in a room hanging out together. And for those of you in this session with us, if you could please help us frame out what you want to know. We have approximately 54 minutes together or so. So if you could put in the question and answer block, like if we're successful sharing our stories and information with you over the next 50 minutes or so, let us know what we need to do to be that way. And then we'll go that route. So what we know literally in the data, if you just want to kind of a frame, is that the rates of prevalence for mental health and juvenile justice or mental health issues within juvenile justice systems really range anywhere from 25 to 75%, depending on the study that you look at. And what those really are telling you is that kids in the community tend to have some struggles with that. Kids in systems have struggles with it. But more, I think, concentrated are the issues with youth that end up in institutions, especially when they come through the juvenile justice pathway to do that. So if you get past all the prevalence studies, here's what we know. In 2022, the Urban Institute found that approximately 66% of youth in correctional settings had at least one diagnosable mental health need. And that's a huge jump compared to the general population of anywhere from 9 to 22% of any kid who's not justice involved. More specifically, the Coalition of Juvenile Justice has found that anywhere from 81% to 92% of girls in institutions, compared to 66% to 68% of boys in institutions, juvenile justice institutions, have a diagnosable mental health need. So while it is super concentrated for youth who end up in institutional care, there is definitely a gender variation with that. My specific research has really found that one of the strongest predictors, or actually the strongest predictor of a young person who's come in contact with the juvenile justice system to end up incarcerated, is the combination of three things. And they may surprise you. First is receiving a violation of probation. For those of you who don't know what that is, that means that the kid didn't break the law, but they didn't do something right that the court ordered them to do. And so that's a technical violation. And when you add that violation with being involved with public community mental health care and having had a trauma exposure, we found that that predicts with an 85% certainty that that youth will end up in an institution. And so when you summarize all of that data, what it has allowed some folks to postulate is that, or to guess is, that kids are not necessarily coming into the juvenile justice system and ending up in juvenile institutions because they're extremely violent and a threat to the community, but perhaps rather because they're trying to access appropriate and adequate care. And on the other side, folks will say, well, juvenile justice is not designed to provide that care. Definitely the community is where we should be. And so I could give you death by PowerPoint and citing after citing after citing, study after study after study. In your resource list, there's links to hundreds of articles that the John D. and Catherine T. MacArthur Foundation pulled together in their Models for Change effort that can tell the story. But people are data too. And I think that's one of the reasons why we have such a dynamic panel here. So with that frame, what I'd love to do is just open it up for anyone on the panel who feels comfortable to kind of start this conversation off to say, why are we here? Like, what is the issue? Despite the prevalence, like, is it so terrible if a kid goes to a juvenile justice institution to try to get mental health care? Like, what's the problem with that as being the naysayer?
I can kick us off if that's okay.
Yes.
Hello again, everybody. Evelyn Clark. So I was incarcerated as a young person, and I will acknowledge that I have certain privileges. Although I am Mexican and Native, I also am white passing. So my experiences were a lot different than the young people I served in Washington State. A lot of young people I served were primarily Black, Indigenous, or people of color, BIPOC. And with that, I would even disagree with some of that research. I'm not a researcher, but I will tell you that I'm an informal researcher. I have seen young people go through, and I'm going to talk more of not necessarily my own lived experience, but mostly to the racial justice aspect to this work. But I would see young people come in who were Black and brown, and they would not be diagnosed. But we know that the moment of arrest and when you step into the juvenile detention or juvenile prisons, that already is causing trauma. And so what I saw was that kids who were white were getting the diagnosis. When you walked into prisons, they would have a mental health unit. And guess who made up that unit? White kids. And so they would separate young people who, I know Dr. Cam can speak to this too. They would separate young people who were Black and brown who were involved in gangs. And the reason why I so think this is important and vital is because when you do assessments with young people, especially young people of color, I literally have watched clinicians just sit there and read each question, not even making eye contact. A lot of these young people, especially Black and brown young people, don't even know what the word trauma means. So of course they're not going to make it to the diagnosis part. So I would say that when we're really working with these young people, that we need to take that in consideration, the culture aspect, the racism that is embedded in these assessments. We have to really take a look at who's even providing these assessments. I'm not a clinician, I'm a certified peer counselor. And so when I would go in there, I would re-ask these questions. And I would get so much more out of these young people because of my lived experience and because of, knowing how to engage. So I just wanted to start us off on that because, again, it's truly, I don't agree with that research. I agree that there are more young people with diagnosis, and due to the racism in the system, that is not getting captured.
Either that they're not, let me make sure I'm summarizing what you said, that they're coming in, but they're not being assessed appropriately because of the assessments being very whitewashed, for lack of a better term, and or the youth not understanding the words that are used within those assessments and what they mean to them. Would I get wrong, Evelyn?
No, absolutely correct. Thank you.
Awesome. And I can tell some folks have come off mic. I'm wondering if Kristen and or Dr. Cam, y'all seem primed and ready to jump on this discussion. Like, what would you like to share? Whichever one of you wants to go next.
I can go. And to really piggyback off of what Evelyn was talking about, and I am a researcher, so I also do not agree with that data to a certain extent. I think that one of the things that gets convoluted when we're talking about actual people is the social structures that are around them. And so, just me saying that, I'm from Compton, I am labeled, I am ascribed certain things to who I am as a person. And we let those things kind of drive the work that we do when we're trying to help our youth. And so when I talk about like being from Compton, people automatically put me in this bracket of coming from an impoverished community. And while it was impoverished in some aspects, right, my family was a middle class family. That is something that they would call a protective factor, but for me growing up in Compton, it really isn't. So I think you have these different compounds of like labeling individuals to be these certain things that get in the way of not only building services, but also providing services for youth. And I definitely agree with the fact that, right, trauma means something different to a person that grows up in a more urban community and sees violence every day. And as a youth, I've had white practitioners tell me that I have PTSD from growing up in Compton, right? Because of the things that I've seen. Now, where I am, and all of the education that I've attained, and all of the certificates, and actually being with my community, I don't think that that is how we view trauma coming out of those communities. It is something that is a normal culture that happens, and people from the outside view it in a different light of impacting youth and young people.
You know, they talk a lot about the intersectionality of complex trauma and communities that are in, you know, isolated, marginalized communities, and how the responses of living within that, we tend to criminalize even some of those behaviors. Cam, would you say I'm off point with that kind of a summary?
Yeah, I definitely agree with you. And I've seen it not only in my work, but also in my lived experience, right? In my community, fighting is something that we do on a regular basis. And so people outside of my community would look at that in a negative light, and look at it as like, oh, violence is an issue. But that is how we, you know, have disputes. That's how we settle disputes where I grew up from. It was a normal cultural thing that happened. You have an argument with someone and it gets to this point and you guys fight. And then, you know, after the fight is over, then it's, you know, I love you. We see that happening not only between friends, but also within family units. Like that is the culture. Also, when you think about things like, you know, spanking versus not spanking, right? And so, like, when I was a youth, I got my butt whooped. Do I think it helped me? Most definitely. Do I think it traumatized me? Not at all, right? I had to learn that there were consequences as a young child for the things that I did. And I think that has actually helped me to get to where I am now, to be able to understand and to teach others, right? Like there is this consequence for anything that you do. It could be good or bad. And you have to make decisions based on if you're willing to accept whatever those consequences are. So I feel like it is viewed very differently. And when you have outside people placing these different labels on you, that is what perpetuates the racism. That's what perpetuates the barriers for especially people of color to move forward or to rally together and actually help each other.
You know, some of the things I hear you lifting up, I wanted to know kind of, you know, Kristen, like your perspective, because one of the things that I remember you and I chatting about when we were prepping for this was like, there's some stigma involved with being the kid who has to go to get some mental health care. Like, am I not tough enough to handle this? Or, you know, how can I get that? So, you know, like, could you share a little bit with us about your perspective and all of this that you're hearing?
Yeah, one of the things I was thinking about while everybody was talking is like in the juvenile facilities, specifically in Kansas, where I grew up, there's not even really mental health services. They have mental health workers, but that's literally the person that provides free phone calls with your family once a week or puts you on suicide watch, which leads you to being in isolation for 24 hours. But as far as like actual like therapy or like caring for your mental health or even getting a diagnosis, stuff like that isn't really happening within juvenile facilities because the main focus there is like you're getting punished for what you did and it's a punitive approach. I think it's more common in other systems to think about mental health, but not really in the juvenile facilities. I know that when you commit a serious crime, most of the time they'll do a psychological evaluation, but that evaluation is like really quick. It's really like answer these questions and then we're going to refer to the judge, whatever we find out. And I'm pretty sure in most of the facilities, it's the same person doing all of the evaluations for all of the youth that are referred for them. So that's one thing that came up for me. And then another thing, based off of your question, was just like feeling safe to even say that there's something wrong with you. So as a kid, I never felt comfortable being like, okay, I have all of this trauma, like, you know, being trafficked, being in foster care, being in the juvenile system. For me, it was more about, okay, I have to act like I'm okay. And it's not cool or normal for you to be like, okay, I'm like dealing with some stuff mentally or emotionally. It's more of like, okay, how am I going to get past this day and like fit in with my peers? So that's not something that's really accepted. And then like, even when you are honest about your mental health, it just leads you to being institutionalized in another way. So maybe I'm in a juvenile detention, but what's the alternative if I say that I'm having like some mental health struggles? That the next thing would be a psychiatric residential facility. And for some people, it's like, okay, do I want to be in a psychiatric facility where they're like having complete control of my body? I remember when I was a kid, everybody talked about, I don't know like what the medical or like professional term is, but everybody called it the booty juice. So like if you were going crazy, they could just like put a shot in you and then make you calm down, and then you're like unconscious. And like that was like the worst of the worst. Like people were like, you don't want to have that happen to you. So for me, I felt more safe not talking about that because I didn't want to be in a situation where I had no control over my mind or my body. So as an adult, that was something that I had to like take on myself, and like going through like all of the stigmas from therapy, because being in foster care, when you're in therapy, that's like a part of your court report is your therapist has to submit your therapy stuff to your judge. And like some of the stuff like as an adult that I read through that was in my court reports was like completely inappropriate and like stuff that never should have been in that report. It was just like my therapist telling all my business to the judge. And I'm like, okay, I'm never going to go to therapy. So it took me like 8 years as an adult to overcome like all of those thoughts and feelings that I had attached to it.
It's fascinating what you bring up, Kristen. Like, you know, again, some of the research, you know, people think they're in these academic towers and they're like, let me study all this stuff. And there's this body of work coming out. It's talking about what they call the treater turned monitor syndrome, which is where a mental health person, a clinician or a social worker working with a kid or a family that has been involved with the law enforcement loses their ability to be as empathetic as they'd like to, and they start actually becoming more like a quasi probation or parole officer, like you're non-compliant, right? You're non-compliant for your treatment, you're non-compliant for your thing, and then that triples down what we call dosage in the clinical world, and in the justice side we'd call surveillance, right? And it's like that leads to violations and incarceration. Like, would you say that's some of the things that you saw folks experience from your perspective? Yeah. Mary, I'm wondering about you as a parent. Like, I could not imagine. I remember the first kid I had to put in detention. He couldn't have been 56 pounds wet. You know, his jumpsuit didn't fit him. You know, I have a talk I called Teddy Bears Behind Bars, and I cried. But he was 11, and he burned down a church. And that was I had no call. There was nothing I could do. It was a bad felony, and the court said it. I'm wondering, as a parent, like, how does this all, what you're hearing these ladies say, how does everything land on you?
You know, it's interesting because I'm, you know, this is my village, right? But I'm bringing the family voice, but I'm right there with everything that's been shared through Evelyn, Cam, and Kristen. I think a few things, Kristen, that you kind of touched on that I want to highlight too is that there's no opportunity for the family to heal, right? And if they're supposed to be there for their young person, it's extremely hard. And we talk about trauma, but we don't talk about healing, and we don't talk about grief, right? So separating. We separate siblings from siblings. We separate children from parents, and we blame. It goes to blame and shame. There are systems that have excellent people that work in them, and they're broken, and they've got to change. I experienced, Evelyn, you've shared a little bit. I experience white privilege. I see how it happens, and I see the trauma, the harm, and the judgment that I received with my kids ongoing. One of the things that I often said was, I was the parent that continued to show up. I started doing the dance differently. It wasn't about how people engaged with me. They didn't even interact with me in a way that I felt that was getting me at a place at the table, right? And I think one of the things you also highlight in the conversation is when the trauma comes in, how do we actually help people to continue to show up? I consistently say, if we could look at a lens and think about young people and families from a lens of what is helpful and what is harmful, maybe we would do different things in how we show up for families, because you can't get things back. If you miss a birthday celebration, right, that life experience went away. Well, if you are institutionalized for 2 years, you have changed how I show up in my family culture, how I get to hug my kids or not touch my kids. It's extremely painful. And when does the healing come? I think is just another piece of really looking at that and recognizing it. The other thing that I wanted to say too is, I love research. I'm not a researcher. My MD is, I've got the mother's degree. That's my MD, right? Like, I'm a grandparent raising a grandkid. I'm doing it better because I know better. But here's the piece that I don't understand, and I'd love us to really think about. We look at adverse childhood experience and risks, but we don't look at adverse systemic experience, how the systems make us feel, how we show up, right? How do you take that layer of pain off so that you can do things differently? Professionals have a bad day, right? I get that. But if I have a bad day, it takes me 5 to 8 more times to try to keep in control so that you didn't document how I showed up, right? Don't judge me. Be with me and walk side by side.
I love that. There was a young family I worked with, and I will tell you guys, I was the worst probation officer till I became a good one. And that I felt bad for every family I partnered with till I learned the right way to do it. And I'll never forget this. It was Christopher and Frankie Floyd. I have permission to share their names because I've stayed connected with them all these years. When I was an on-call officer, and one of the things that would happen when I was on call, what that meant for you all who don't know, is I had to make the decision if a kid went to detention or not. And this kiddo kept getting, first 6 weeks of class, kept getting brought in by the cops for, you know it, disorderly conduct, assault of a teacher, you name it. He was escalating in the classroom. The school couldn't handle him. And every time I'd bring him in, I'd be like, Chris, what are you doing? Call his mom. Frankie would come in. I'd release him because I thought it was just school behavior. And Frankie would say, it's just the school. And finally, he got a felony because he threw a chair at the teacher. And I had to put him in detention. I didn't know what else to do. And Frankie came into my office, and I told her I had to keep him detained. And she picked up a chair and threw it across my office. She was so angry and hurt and wasn't listened to. And I still remember to this day, my boss came running down the hall. He was a 6'8" football player. Like, he was a scary dude. And I literally was like, hold on, and I finally picked up the chair and I sat down and I said, Frankie, what am I not listening to? Help me. I'm not listening. So I'm not hearing something. And to get to it, and I'll punt to Cam because I see she wants to jump in. What we found out was the kid had been diagnosed with bipolar disorder, was misdiagnosed as ADHD for the longest time. Some of the questions in here are, those present almost exactly the same in young kids, right, Mary? And what had happened was the psychotropics he needed were not covered by Medicaid, and she couldn't afford them. So in the summer, she would take him off the medication because he was fine in the country of Cristobal, Texas. He could run around. There was no problem. In her mind, it was the school because he was fine when he was with her. And the confinements, I think, Mary, to the classroom and the structure, and you must maintain. And so it takes 6 to 8 weeks for that medication to get into a system and for that to be able to be balanced. And they didn't know that. When we figured all that, everything was fine. But I'll never forget that story. It changed the entire way I'm wired about listening to families and how quickly that could have escalated in Chris going to prison because it was a felony. Cam?
Yeah, it just kind of made me think about my own mental health when I was a kid. And I remember, like, to the day, my mom took me to Big Spinos, which is like, it's in Long Beach, but it's a very, like, more predominantly white, higher incomes. And she took me to a therapist there. And the very first day, the therapist sat me down, and she was an older white lady. And she was like trying to talk to me, and I wouldn't say anything to her. And she was like, I don't understand why you just won't talk to me. And I was like, because you don't understand. You don't understand. I'm a Black little girl, right? I grew up in Compton, and you don't understand me. So how can you actually help me? Um, and that was the last time I saw that therapist. And I did get into a lot of trouble, after that happened. But now, like, looking back, I think that is what is happening to a lot of, especially kids of color. For one, mental health is not um, this thing that you talk about, culturally speaking. I remember, like, aunts and stuff that now I know that they had mental health issues. And I remember as a kid, like, my mom or great aunt saying, "Oh, don't pay her no mind. Auntie so and so is just a little crazy," right? Like, it is dismissed. I also feel like, kind of piggybacking on what everybody is saying, it's also systemic, right? In the Black community, the way we are seen by other communities is like, we have to always be strong. We can't show weakness. Even from, like, the more detrimental talks about how Black people are these barbaric type of animals, right? Like, that has followed us through. So to talk about something that society views as this weakness, like, we don't have the space to do that. And so I think it comes from, like, changing that whole narrative, letting it be okay. And I think that that is something hard to do when for years and years we've created a barrier to allowing these groups of people to even reach out for help.
Thank you for sharing that, Cam, and for everyone being so honest and transparent and frank about your experiences. Like, one of the things that's come up in the question box, I see as a connection with some of the things we try to do in Texas is we try to use specialized probation officers to work in schools to divert kids from adjudication or divert kids from the juvenile justice system. And then the advocacy world was like, it shouldn't be a law enforcement intervention. You need to flip those people out. And one of the arguments we used for that was that it was easier for boys in the 5th Ward of Houston to say they're talking to their PO, their probation officer, than it was for the kid to say he's getting some mental health help. So it was like we gave him, it was like mental health and drag, for lack of a term, but it was hiding behind law enforcement. And good, bad, or indifferent, we thought that was a good approach at the time. And now you can think back and see how those things maybe weren't so effective. But one of the questions, and it's gotten 18 upvotes, so I feel like the world out there really wants me to ask it of you all, is we sometimes find that there are youth who deny their mental health struggles or will become hostile at the idea of being perceived weak. How can we assist them when that is the case? And that seems to be some of the things y'all are talking about. So what can people do?
I can take this one. And then if any of my fellow panelists want to join me in it. I would say, so I was thinking of a experience I had with a clinician who was white. I was working with a young man who was incarcerated. He had just gotten shot, and he was in a wheelchair and incarcerated for a robbery. And I remember asking the clinician to help assist, since they are the mental health professional. I was the peer counselor. And she looked at me and she said, "Evelyn, I did not go to school to work with kids like him. I went to school to work with white kids who struggle with suicidal ideation." So we could take that word hostile, which I personally do not like. I was called hostile as a child. I also know that these kids are not hostile. They are. So to my point, this young man seemed hostile, right? He was in for a robbery. He had gotten shot. He had guns on him. While working with him, he had said to me, "Miss Evelyn," he said, "I also struggle with suicidal ideation, but the way I get it out is I rob people, or I sell drugs, and I join my gang." Because, excuse me, of the stigma among his culture, being Black, and also, he said, "I would rather be known as the biggest, baddest drug dealer than someone who struggles with their mental health," because, again, of that stigma, right? And so I would just kind of change how we see. Let's see them as young people who have armor on, and underneath that armor is pain and trauma. And if you want to get even more technical, I said to this clinician, I said, "This young man has access to guns. Do you not think that he is more at risk for ending his life?" And so I kind of left her with that. But I'll put it in the chat, but I wrote a blog for NTAC called Mental Health Does Not Discriminate, but Mental Health Organizations, something along those lines, do. They do discriminate. And so in there is a mental health toolkit for clinicians to, and this is for, white clinicians, especially how to work with people who are BIPOC, Black, Indigenous, or people of color, and to really address the racism, because deep down this young person was experiencing racism, which leads to stigma. So I just wanted to share that.
I wanted to jump in, if I could, just to say a few things, kind of going with what you're saying too, Evelyn. Words matter. Words matter, and words matter regarding culture. And I think that, does it have to be called mental health? Can it be called wellness? Can it be called emotional support, right? What is the word that works for the family and the young person? So language is a huge priority in my work with the peer-to-peer connection. I can pretty much get any young person or family to the table, whether they're angry or they're often not showing up because they've been beat up for so long. I can get them to the table because the first thing I do is build trust. What do you want to call it? How do you identify it? What's your language that you use to explain it? That's number one. And as a parent that has been in that, my first child, I still am saying, I feel like I'm still apologizing to him. Listen, you didn't get the best me. I'm now on like the fourth kid, fifth kid, right? Like they're getting a different me. But part of it was when a therapist said to me that there were relationship issues. There wasn't relationship issues. I was the Italian Irish mom, and he just needed to listen. That was my culture. That wasn't my kid's problem, right? But the way that people show up for us, language matters. I love what you said, Evelyn, about everyone's a warrior and figure out how to get in there and support them and trust them. And then the last thing that I would also go to is, and this I think comes up more in the medical field than the mental health, it's okay if you don't know how to help a family, tag yourself out. It's okay. Everybody has biases. Everybody needs help. So, as professionals, I don't expect you to have all the answers, but what I do expect you to do is not label my kids and label my family with mental health. So then I not only put up a door, I've got 3 bolts on that door, I've got the chair behind it in the dresser, and I'm not trusting you, right?
Mhm.
It's okay also, remember, I teach families to say when they've made mistakes, or young people, we admit it. Families and young people need to hear from professionals like you. Erin, you had said, hey, listen, I made a mistake. You were my teaching opportunity to do better, right? Build that together.
Yeah, I definitely second that. So just thinking, putting my mental health hat on, as a provider, I always step into spaces as my authentic self. And that is not done, um, across organizations, across professions. People aren't stepping in to their authentic selves. And I do a lot of teaching and training and talking about, right, like just being your authentic self, and going back to like my first encounter with mental health. If that lady would have came in and like, hey, I don't really know what it's like to be you. I don't understand your culture, your the city that you come from. Like, I don't understand any of that, but I would like to get to know who you are and what you're going through. That lands completely better than tell me about what's happening. I'm not telling you Jack. You know what I'm saying? I'm not telling you anything about me. And so that is the lessons that I take when I'm interacting with youth, when I'm doing therapy with youth, right? One of the things that I do is stand in their culture. So one of the biggest things that I start everything off with is, what is your culture? Right? We are not the same. We don't come from the same place. We may have some overlapping, some understanding in between our cultures, but what does your culture look like for you as a kid? And I'll push them to lean into that, right? Especially kids of color. Like, lift up the fact, this is where you come from, this is what you're into, and all of these things are part of your culture. And then I share where I come from, and we see what things overlap. The biggest hurdle is that, and this is why I will quit a mental health job in a heartbeat. um, the system doesn't allow you the space to do that. As a mental health professional, you have to walk in there, diagnose them, and give them a label so that you can bill, right? And your company can get paid to pay you in the very first session. There is no therapist that I've ever encountered that can meet a person one time and actually know what their underlying mental health issues are. So I also feel like it is not okay for the larger system to force us into doing that before we've even actually made a good connection with that person. And we, as mental health professionals, have to find ways around that. What can I put on this paper that will get us paid but does the least amount of detriment to this person? The other thing is, clinicians will put stuff down and never go back and change that diagnosis. Go back into the system and change that diagnosis and actually make it correct.
Kristen, what about you? Like, we've heard from everyone else. Like, what would you say is something that people could do different?
I have so many thoughts. I'm trying to figure out which one I want to say.
Whatever
So-
comes up first.
One thing I was thinking of is there's a lot of young people that are diagnosed with like similar things. And like one thing that I know is like a lot of people in systems are diagnosed with PTSD. A lot of young people are diagnosed with ODD. And like those are the things that like you hear over and over again. And like that's one of the things I was diagnosed with as a young person. But now that I'm older and like I actually know my diagnosis, it's like, okay, did they actually like try to figure out what was wrong with me, or did they just try to slap a label on me? Because now that I'm talking to my therapist, like she's teaching me like, okay, some of this stuff is like actually stuff that's going on in your body, that's like a chemical reaction, and some of this stuff is because of your trauma. And she's been like explaining it to me like that and saying like, okay, this situation happened, is this a symptom of this mental health diagnosis, or is this a symptom of this? And like she's really been able to break that down for me to help me understand like where is this stuff coming from. So that's one thing that I think is important when working with people that have experienced a lot of trauma, is like actually taking the time to give them the right diagnosis and not just like slapping a label on them to get the paperwork done or get them through the process. And then another thing, when I was hearing everybody talk, is building relationships and building trust was a big thing for me as a young person. And when I was 18, my very first job was working with trafficking survivors and doing healing work with them. And I learned about motivational interviewing. And I really loved that idea and like that practice, because I learned that there's a difference between working with somebody and telling them like, okay, this is what I think you should do, or giving them your advice, or asking them questions to draw those things out of them so that way they can actually like evaluate their situation and come up with ideas that will actually work with them or work for them. So that's one thing that I think is really important, because I think as older people working with young people, we're so quick to say, you should do this or you need to do this. And that's not like, young people don't like that. They want to be like, this was my idea. Like, this is something that I thought about. So if you don't know about motivational interviewing, I think that's something that is really important when working with young people. And I forgot what my last thought was, but yeah.
I think what I want to highlight here is something that shifted for you. And I want to see if I picked it up, right? So correct me if I got it wrong. But like on one hand, you were like, because there's your MI, right? Let's do both sides. But on the one hand, you're like, and when you were a kiddo, like they didn't talk to you about it. They just gave you some kind of a label and forced something on you. But then as an adult, they treated you more as a person to rely and collaborate with and discuss and discover. I would say that did I miss that, Kristen, or did I get it right?
No, you got it right.
Great. I'm curious for this panel, like, what would you think about a world where we actually talk to the kids about what they thought would be helpful? Like, I mean, at any point in time, I have teenage nieces and nephews, and they're in this weird little world between being a little kid and wanting to be an adult. And yet they know who they are. They're starting to discover it, right? That's part of that autonomy, that child autonomy. And kids are the only set of people and adolescents in our country that we can diagnose or detain simply because of how old they are. Let me repeat that. There's entire codes in the DSM that only apply to children. And there's statutes that only apply to children. So I'm curious, like, what would y'all thoughts be in a world where we engage youth in a more of a stronger partnership? Does that make sense, Kristen, or did I completely mess up what I think my question is? Somebody help me out. I'm not the right person to be the moderator for this. You know what I mean? What do y'all think?
So I have a thought. Kristen, did you want to go first, or do you want me to jump in?
You can jump in.
Okay. So here's, I love that idea, Erin, and then I start getting nervous, and I'm going to tell you why. We need to be able to understand brain development. We need to teach people, right, about how. So I always want to go to, what does the youth need? What does the family need? But I safeguard, because when I had that trust and I didn't realize people didn't have the correct training to understand things, I didn't want to harm people, right? And I think that we've got to well-train people on brain development, how to interact with families, how to show up, right? Kristen, love motivational interviewing. I love it. My kids were doing it on me until somebody told me that's what they were doing on me. I was like, well, in DBT, right, dialectical behavioral therapy, I got to go through a whole parent class of 12, 18 weeks to figure out how to use some damn metaphor to do it right. Right? But then when my kids are doing motivational interviewing and like ARC therapy on me and saying, Mom, you're a little high. I'm like, I'm really not under any substances. No, your emotions are high. Well, why don't you train me? Right? So I love the idea, but we also need to give people the tools in the backpack to not do harm by families. So do you know brain development? Do you understand the dangers to detention? Do you know that it's a pipeline to incarceration? Do you know that youth that are in foster care, they're not foster youth. They are young people. That's the system they've been identified in. But guess what? When the states across cherry pick who's important enough to get the right services, is there truly opportunity for all? Where's the equality? Right? So I love it, Erin, knowing who you are and probably some of these people on this meeting. But I want to make sure too that we recognize the harms if you don't understand and a young person opens up to you. I don't need you to document it again and again and again so Cam never has a chance. Right? Talk more, document less. Give me a chance to not be the file in the case that you read and be the person that shows up that needs to get to a place of healing. But I got to tell you, it is about this partnership in doing the work together. That's kind of my lens of what you're saying. I immediately got excited and I immediately got scared, Erin. I was like, ooh, this could be harmful. It's kind of like interrogation, right? We talk about the police are there and they're community helpers. One of my messages is when you get to be 8 years old, don't talk to the police without somebody there. It's not against the police. I want to safeguard things, right? You don't know what you don't know until we work together.
Mm-hmm. And being willing to be scared to figure it out. Cam?
I feel on the borderline with this, and I think because of my own personal experiences and then my professional one. So as a social worker, I try to do my best to advocate for any of the families that I work with. On the other side of it, right, dealing with my own kids, I try to educate them. And they'll even, if you ask them, they'll be like, my mom traumatizes me all the time, right? They see this in a different light, but it's because I'm giving them information that they need to be successful in this world. Do I want to be giving them that information? No. But at a young age, even with my son, so we live in Utah now, which is very, very white, very, very Mormon. So at the age of 5, I had to explain to my son at 5 years old, like, these different situations can happen. That's triggering for me as a parent, but my son needs to know it, right? He had a situation where he was at school, very smart. They were all working on tablets. He took over the tablet. So the teacher kind of had it out for him because it was projecting to the whole classroom, which I totally get. And then the next incident that happens, the teacher says, well, makes a kind of derogatory statement to him and the other Hispanic kid that was in the classroom of like, if they don't listen or follow directions, then they get the police called on him. So the next instance of my son and this teacher kind of having their, issues back and forth, my son gets up out the classroom, goes to the front desk and calls the police on the teacher and tells the police, I feel threatened. And the police call me. And so I had to explain to the police, like, he's not going to get in trouble for calling you. That is what you're there for. You are there to protect all of these kids, no matter what they look like. So if he feels threatened, then you should respond, right? So I think it's just a matter of not only reteaching our kids and giving our kids information, but also the professionals. We have to teach them because they don't know. And that's how I kind of feel about that, kind of on the line, on the fence.
Well, we have like 6 minutes left. I want to open it up to the panel and be like, if there's like one takeaway, and I think, Mary, some of your quotes, I wish ChatGPT was summarizing, because I want to put those into like, I want to steal them and make them like my new coffee mug. I really do. Anyway, that's a whole nother story. But I'm wondering if each of you would mind just going around real quick and be like, if you could leave this group with a takeaway, what could we do? What could we do different, or what should we hope for? What would that be? And I'm just gonna let you self-select who goes first.
I'll go. For me, it would be lean into people that have lived experience to help you navigate these spaces. So you need people with lived experience on your team to be able to help support you, because especially if you're not directly connected to that community that you're helping out with, if you're not aligned with some of the racialized hurdles that that family has to go through, this is why people with lived experience are invaluable to systems, period.
And we've started calling it lived expertise. I don't remember where I heard it, but I loved it. I was trying to make another mug. Anybody want to steal that for a mug? You don't even have to quote me. Mary, what would you leave them with?
I'm a big person that talks about collaboration and partnership. So I would just offer that everyone here has an opportunity to be a change agent. We need you to be an ally, to walk side by side, sometimes teaching advocacy when it's not something that's known, but to be that ally always with a young person in the family, and know that you have an opportunity daily to change the system that you're in as a change agent. And we're here side by side with you with living and lived experience.
I would say there needs to be a bigger push for mental health services within the juvenile system. I was talking to somebody the other day, and we were talking about healing after you're incarcerated. And she's like, well, the system's supposed to be rehabilitative. Don't they already have access to therapy while they're incarcerated? And I was like, no, they don't. Like, you can't even start your healing process until you are released. Like, that's not even something that you will even have access to. So I think that that's something that people need to think about more, is if we really want young people to have an opportunity to be different or to change or to be able to heal, they should have access to these things well before they're released from being in detention or from prison.
Thank you, Krista. Evelyn?
Yeah, these are all great. I would say don't ever give up on young people or families. There's a young man I've worked with for 10 years, 15 years old. He's now 25. Unfortunately, he had to go to the adult prison, but he's done phenomenal things. Him and I started youth voice initiatives within the prisons. He's done bill legislation. And the first time I met him, I knew how much of a leader he was among many of the young people. And he just had his clemency hearing. So we're waiting for him to be pardoned by the governor. We're just going to speak that. But I say that to say is I never gave up on him. And he went on with that, and he literally started changing laws. He testified in front of the U.S. Congress with Brian Stevenson, and has been phenomenal. And you just see the fruit of the work. And it may not even be that. Unfortunately, in America, we know that the criminal justice, juvenile justice systems are the modern day slavery systems. Will we ever get rid of them? I don't know. However, we can continue to not give up on them and continue to show the love that they deserve.
Well, thank you, everyone. I think it's time for us to wrap up. I wish we could talk for another 2 hours. I feel like I have new best friends. But thank you very much for letting me hang out with you. I really enjoyed everything y'all had to say, and you've given me a lot to think about and to move forward on. Right, Cam? I'm going to hand it back over to Ashley.
Thanks y'all so much. And like we do with all of our keynotes, we have a visual summary. So that mug, Aaron, your mug can happen. Your mug can happen. Yen is going to share her screen. Here are the visual notes from what we just talked about. We're going to upload this visual into the booth, the summary booth. We encourage you to download this visual, print it out, hand it out, pass it out, help people to learn about what we talked about today, about that intersection of mental health and juvenile justice. Look at the amazing things, the amazing conversations that we had. And as that's happening, we are also going to acknowledge and our ASL interpreter. Thank you, Rebecca, for being here. And I know she's going to switch out with Tanisha so we can do our award ceremony. Y'all, this is what we've been talking about, uplifting the system of care champions. This is only going to be for a few minutes. Y'all stay. Please keep sending those hearts. Please keep sending those congratulations. And I am so excited to talk about our system of care champions. These folks were nominated by their community and peers for their exceptional work. And then the final selections were made by a panel of family, youth, and our Intact partners. And so this ceremony is going to be filled with lots of learning moments in just 30 minutes. Instead of hearing lots of, thanks to my mom or thanks to my parents, which we definitely want to thank and congratulate our caregivers and those in our lives. Our awardees are going to share insights and wisdom from their journey. So without further ado, let's kick things off by celebrating the System of Care Youth and Young Adult Champion. Go ahead and put hearts in the chat for this person. This award recognizes young people between the ages of 16 and 21 who advocate and support youth mental health and have lived experience. And our 2024 Youth and Young Adult Champion is the remarkable Sanavi. We're so excited about Sanavi. She is the co-founder and executive director for the Youth Power Project. Drawing from her lived experience and mental health challenges, Sanavi has become an exceptional leader, y'all, uplifting youth voice in health policy and advocacy. And under her guidance, the Youth Power Project has successfully introduced over a dozen impactful mental health legislations at the state and the federal levels through youth-driven approaches. So let's congratulate Sanavi. You are a true champion for youth mental health. Sanavi, we'd love to hear from you. I'll pass you the mic.
Thank you so much, Ashley. Hi, everyone. My name is Sanvi. I use she, her pronouns. I'm 19 years old. I'm from Berkeley, California. I go to UC Berkeley. I'm currently a second-year undergraduate there. I'm studying computer science and public policy. And as Ashley mentioned, I work with an organization that I co-founded called the Youth Power Project. And my overall focus has really been demystifying public policy and advocacy spaces for students, particularly in the adolescent health and wellness space, to amplify lived experiences across the continuum of care to school administrators and state and federal lawmakers, to secure the funding and policy changes that are critical to ensuring that students and youth and young adults are receiving the care that they need. This kind of I got into this particularly because of my own personal experience. I say this a lot, but I was probably one of the most civically apathetic people ever. I didn't know how to advocate for myself when I was younger. I struggled a lot with mental health struggles throughout my adolescence, but I grew up in an environment where having discussions regarding my own mental health wasn't really possible or an opportunity for me. So for a long time, without the ability to seek a diagnosis or really speak to those in my community or get support for my mental health, I misunderstood my struggles and didn't really know how to explain what I was feeling or who to explain that to. And then facing some losses in my life at a young age with others in my community who had similar struggles kind of really taught me or showed me the importance of kind of normalizing and destigmatizing the concept of mental health in my community, and especially amongst youth and young adults. And it's, I guess, during the pandemic when I was in high school, and now I'm in college. That's kind of when we kind of did move the needle on destigmatizing mental health, at least in my community. But it really struck me that it took losing someone in my life to realize what I was going through, or for my community to kind of take a step back and start to re-examine mental health. So I began serving as like a remote peer counselor during high school, and then started working in my community with administrators to study common mental health concerns. And that gave me a lot of like local organizing skills, kind of just like in my community, and was really grounding. And then soon after that, I started working on state legislation that one of my friends had actually authored, and I thought it was so cool that like someone my age who had a similar experience to me was able to write a piece of legislation and like shape policy based on their own experiences. So that became something that I became super, super interested in. And I was like, that's so cool that like someone my age could do something like that. And so then I kind of tried to do that too, and was able to work with my peers to start developing like a systematic way to bring like lived experiences and young people into the policymaking place or space. This was just so transformative for me, and it's something that I care a lot about. I want every young person to be able to experience that feeling of being able to take something that you really, really care about, that is so personal to you, and step outside of yourself and uplift a broader community. So I'm so grateful to receive this award, and I'm so grateful to have been able to be a part of this summit. It's so lovely to meet everybody and hear from such amazing individuals. And thank you all so much for your time and appreciation.
Thank you so much, Sonavi. Wow, talk about a champion and transformative. Oh my gosh, just congratulations again. And we're just so excited to share this space with you today at our award ceremony. All right, our next award, Equity Champion, recognizes those driving efforts to improve the mental health system of care for children, young adults, and families with diverse racial, ethnic, linguistic, sexual orientation, and/or gender identities. This year's recipient is Renita Harris from the Roberts Family Development Center's African American Healing Network. As a program manager, Renita has brought essential, culturally responsive mental health services to underserved families in the Del Paso Heights community. Through normalizing mental health conversations and integrating cultural practices, she has created a supportive space where families can recognize their capacity for healing. Renita's innovative, family-centered approaches have increased access to care, empowered individuals, and fostered inclusive services tailored to all families' needs. While collaborating with nonprofits, community leaders, and culturally responsive therapists, Renita has transformed the family mental health landscape in the most powerful ways. Join us as we proudly celebrate and support Renita as she continues to improve equitable and healing-centered mental health outcomes in her community. We're excited to hear from you, Renita, and to root for you.
Thank you, Lisa. Can you guys hear me? Yes. Okay. Thank you for this award. The African American Healing Network is a mental health service provided by Roberts Family Development Center through the Community Responsive Wellness Program. We believe in healing the community from within. We connect African Americans in North Sacramento to Black therapists and Black therapeutic services for free. With our services, we wanted to value the voices and experiences of the people we serve, especially within the African American community. I truly believe that there is no such thing as a voiceless community. We just need the mic. In order to connect people from a community that is already stigmatized for just being who we are, to mental health service, which is also a stigma, we had to change our language and our approach. Firstly, the CEO and COO of Roberts Family Development Center are Black. They have provided services in the community for over 21 years, and their staff reflects the community as well. This in itself is a first step in healing. Sometimes for African Americans, seeing a Black person they trust allows their shoulders to relax and create safe spaces for engagement. Then we have to acknowledge our cultural healing practices. It's okay to be Black. The world likes to condemn our African American culture, which can lead to internalized racism. So our first step was lifting up the cultural healing that has taken place in our community and acknowledging those therapeutic benefits. Firstly, being part of an organization with Black leaders. Secondly, providing a safe space that highlights African American experiences in our services. And thirdly, lifting up what has gotten us through slavery, Jim Crow, civil rights, and institutionalized racism. What do we do as a community to heal? That is being with community. Our cultural practices include storytelling, food, and dancing as a way to prevent isolation and commune. So we took on healing through the lens of a Black person in America. We asked the community, what brings you joy? What does a safe space look like to you? What is healing? We acknowledge the trauma and grief that parents were facing in the community with losing a child to violence. So we had community listening sessions. What is grief to you? What does grief support look like for you? Through this, we created therapy groups in the form of open mics, physical fitness classes through soul line dancing, and yoga with a Black instructor, and grief support groups for parents who have lost children, specifically for Black parents, because navigating grief in America, access to resources and compassion levels look different for us. We created suicide awareness and reentry educational services, but the knowledge came from Black people who experienced that and what they did to cope. So firstly, we acknowledged and lifted what the community already does, and now we can introduce ways to enhance, and that's where we talked about therapy, but with therapy with African American trauma-informed therapists, and making sure we acknowledge therapists who understood the community because there are cultures within our culture. So taking the time to understand that and understanding that just putting a Black face in does nothing. So I'm deeply honored for this award, this Champion Equity Award. Our journey has been about recognizing and valuing the diverse voices within the African American community and creating safe spaces for empowerment, healing, and joy.
Yay, Renita! My face is going to be hurting from just smiling. I'm so proud of all of our awardees. Congratulations, Renita. And next up, we are excited to announce our Family Champion. The Family Champion Award recognizes a family member, guardian, or caregiver of a young person with mental health challenges who advocates for and supports other families. This year's Family Champion awardee is none other than Rochelle Madigan, Program Director for the System of Care with the Washington State Community Connectors. As a mother of 8 who has navigated behavioral health systems herself, Rochelle champions trauma-informed and person-centered care approaches for families. Through advocacy, she has initiated a culture shift in system design, data practices, and cross-system collaboration to meet families where they are. Rochelle's impactful work extends to the community through education on cultural humility and visioning the role of family leaders in implementing statewide crisis response initiatives. So join us in celebrating and supporting Rochelle. Let's give some hand claps. Rochelle, we love to hear from you.
Thank you so much. Hopefully they have the picture ready that I was hoping that. Can you guys see that? Is there a picture of a cup showing? Oh, perfect. Okay, great. So I used this cup last year as an illustration in a presentation that I gave as part of a Life After Discharge panel to parents whose kids would soon be discharging from a psychiatric hospital. I had broken this mug, this red mug, into pieces, and then I reshaped those pieces into something totally different. That which was it was a candle holder. That day I was illustrating how our trauma lenses and our expectations can hinder us from finding hope and imagining fresh possibilities. Today I want to share with you 2 other things that this cup symbolizes for me. The first of them is that everyone you meet has the potential to be a champion. Every single one of us is influencing people, whether we realize it or not. I know many amazing people who've made incredible impact in this work and in the world who've never received any kind of recognition. I am no more or less deserving of this award than any of you. The truth is, every single one of us is the recipient of someone else's struggle and their accomplishment. We are standing on the shoulders of the people who've gone before us, who's who have paved the pathways that we now travel freely. That broken mug has the potential to be anything that we can imagine it to be, but it requires someone coming alongside it with vision, hope, intentionality, inspiring it to believe possible the things it cannot make itself into alone. I am that cup, and so are you. The second thing I learned is that we don't have to wait for life to be good to empower someone else to find the good in their lives. Ernest Hemingway once famously said, quote, "We are all broken. That's how the light gets in." End quote. I would add, it's also how the light gets out. There is richness and value in the broken pieces of us, no matter how many times we've been reimagined, how many times we've been rebroken, and how many times we've had to rebuild. Sometimes this work is really hard. Sometimes we have to fight the urge to sweep our own broken pieces into a closet so nobody sees them. Sometimes we have to reach out and ask for help in reimagining our own pieces. In those moments, showing up authentically, even while our rebuild isn't done and some of the pieces are showing, it might just be the thing that gives someone else the audacity to believe their pieces have value too. I'll leave you with these final questions. Who's contributing to your successes, and how can you acknowledge their effort in the shaping of you? Number 2, what are you doing to come alongside those around you? How can you empower them to find hope and beauty, even when everything feels broken? And number 3, how are you authentically managing your own broken places? In answering these questions for myself, I have found the incredible freedom to walk in my life's purpose. It is my hope and prayer that every single one of you finds this same freedom. And when you do, don't stop there just when the light gets in. Let it out, shine brightly. Empower others to do the same, so that the things that once fractured us will become the very things that illuminate the paths for those coming after us. Thank you guys so much.
That was beautiful, Rochelle. Thank you so much. And I quote, standing on the shoulders of our ancestors, I am that cup. Wow. Thank you so much for your humility, your vulnerability, your transparency, and just taking up space. Wow, wow, wow. Congratulations on your work in the community. We appreciate you so much. So our next award recognizes an individual who is leading an innovating system of care work at the state, tribal, or territory level. We were looking for leaders that authentically engage and partner across systems to improve mental health outcomes for children, youth, and families. So this year's System of Care Innovator is Lucas Trout, Project Director for the System of Care Program at Manilica Association. Conducting comprehensive needs assessments across 12 villages, Lucas identified crucial gaps in mental health access for youth and families in these remote communities. He innovatively developed and implemented an integrated social medicine model to provide over 300 individuals with crucial community-driven services yearly, like family therapy, youth support, and parenting classes. Through strategic collaborations with tribes, villages, and program participants, Lucas ensures that care provided is responsive to the local needs, preferences, and cultural practices. Lucas helps people in remote communities realize that accessible and quality mental health care is possible, even when systems have historically overlooked their needs. Join me as we welcome this groundbreaking Systems of Care innovator, Lucas Trout, to the virtual stage. Come through, Lucas.
All right, can folks hear me? Okay, great. Yeah, so thanks so much for bringing some eyes to Northwest Alaska and for recognizing the hard work of our 12 service area tribes, Manilic Association, and in particular our social medicine and integrated care programs, the Harvard Medical School, Department of Global Health and Social Medicine, and everyone else who's devoted their time and effort and expertise to Sayakagvik, which is the Inupiaq name for our system of care. Sayakagvik means a place to heal, which is what we've worked to build through a primary care medical home model for child and adolescent mental health services across our 12 service area villages. I'm honestly a little bashful to accept award on behalf of such a capable and devoted team. I think that'll be the lesson that I share here. The best thing you can do as a project director or a health system leader is to serve as an emissary or maybe an ethnographer whose job is to investigate and understand and describe the values, needs, and priorities of your patients and their caregivers, and then to translate those ideas to the best of your ability into health systems and clinical care. I also wanted to comment on the idea of innovation, which is the name of the award. And though I do think we've come up with some hard-won ideas about how to deliver good care in a hard setting, the skills and practices underlying that innovation are very straightforward and old. It mostly comes down to listening to your care system stakeholders and then doing the very painstaking and slow work of implementing their ideas with fidelity and care. But to pretend that you're the innovator and not the people experiencing mental illness or the frontline clinicians directly charged with their care would be a very silly thing to do. Anyways, I'm very thankful to NTAC, to SAMHSA for its support of our region's mental health service needs, to the hundreds of beneficiaries and family caregivers and health workers and community members who participated in our care system design, and to the whole SciACogVic team that's worked together for almost a decade now to deliver something meaningful for our region. So thank you.
I love it. I love it. Y'all, my heart is just filling up and so full. So we are excited to announce our final award. The final award is given to an organization that is modeling excellence and authentic engagement and developing partnerships to build stronger and more equitable systems of support. And this year's star organization is the Youth Power Project, a national organization empowering youth voices in mental health policymaking. Through their innovative model facilitating youth policymaker collaboration, drafting youth-written legislation, and prioritizing representation of diverse experiences, YPP uplifts underrepresented youth perspectives, and their efforts drive systemic reforms. So I am so excited to again welcome to the stage Sanvi to accept the award on the behalf of the organization. Sanvi?
Everyone, thank you so much for this award. I'm so excited to see, I guess, like to talk a little bit more about YPP, but as Ashley mentioned, our work is really focused on creating a unique procedure for young people to get involved in writing, introducing, and passing experience-driven policies through state, federal, and sometimes local governmental institutions. This kind of originates out of the idea that a lot of the times when we're talking about dealing with needs or dealing with certain experiences, you turn to communities for support, not government institutions. So how can we really meet young people where they're at? That's kind of the goal behind YPP, is really to bridge that gap. We truly and firmly believe that you cannot be constructing youth-oriented policies without consulting young people. At the end of the day, we understand our needs best, and being an ongoing lived experience is the needed qualification that at times just does not inform the way decisions are being made. So I'm so grateful to accept this award on behalf of YPP. I'm so grateful for all the resources that NTAC and other allying organizations that have put together this conference and this summit have always supported us with. And I'm so grateful to continue working intergenerationally and not viewing age as a silo or as a sole determining factor in your experience, but rather providing providing a platform or insight for a more diverse and nuanced perspective. But thank you all so much.
I love it. Thank you all so much. Thank you all. Thank you all. I love the quote that we are all champions. We can all be champions. I want to give another thank you out to our panelists that talked to us about the intersection of mental health and juvenile justice system. Congratulations to all our awardees. And y'all, we did it. Another successful year of the summit. We are already thinking about ways that we can bring this summit to you all again virtually next year. We already have the dates, May 13th through the 15th. And if you are not already a part of our listserv and a part of the Intact community, we encourage you to do so that you don't miss any updates. We have stuff all year, trainings and communities of practice, all of these things at no cost to you all. So we want to see you. This is not goodbye. It's just see you later, right? We'll see you soon. So again, thank you so much for coming to the summit this year. It's been a joy, and I hope to see you all very, very soon at our upcoming Intact events. Y'all take care. I'll see you.